Well, we have a very full 2 days. In the program, we will cover clinical benefits, reducing the likelihood of impacted teeth, harmonizing the width of dental arches, recreating or increasing leeway space. We want to look at transverse and sagittal gains, and most importantly, how we control vertical. Everyone's always interested in, the appliance, the mechanics. So we will go through the one widget, we'll go through the design and the issue and the management of removable expansion appliances. We'll talk about laboratory communications because that is the key to a happy relationship with you and your laboratory and with you and your patient. We'll talk about how you manage emergencies, and we'll talk about the reverse pull face mask and the different types that are available. Early intervention is something that is the cornerstone for our focus. So we're going to talk about under 6 and pre-teen diagnosis and treatment planning. We'll look at evidence bases with thorough literature review. I want to talk about early treatment philosophies and how we modify growth in this early growth period. As we are dealing with young children, we want to talk about patient cooperation. Our second day, we might be looking at things like retention and evaluation of records and things like marketing and how you make your business one that's effective and profitable. Retention strategies will include maintaining treatment changes as the face matures. We want to look at GoPEX and how we utilize applications such as the mobile app designed by Dr. Sandra Kahn. We'll talk about compliance technologies, we'll talk about myofunctional and myopostural reprogramming and what we use in order to make the changes that we hope be resistance to relapse. We'll talk about discipline and motivation. Evaluation, we need to figure out a decent diagnosis. And that comes down to history taking, communication with the patients. We are looking at how you take your exam records. We want to know how to reevaluate once you've started your therapy for maximum medical improvement. Marketing is an interesting proposition because it's not something that we as dentists focus on. But part of our program will be the art and science of promoting premium services from $8,000, $10,000, $20,000 plans for early intervention treatments. We'll talk about how you broach the discussion of early intervention with the layperson who is directed to teenage type treatments. We want to look at how you create your consent forms and your contracts and your financial plan. We want a logical explanation and the use of analogies and storytelling to help communicate what you have gained in your knowledge base and pass it on to the parents who can share that with their family. We'll also talk about case presentation strategies so that you have the capacity by the end of our treatment to convey that information and communicate. Postural Orthodontics, our program of 2 days, will also include special guests. We have Dr. Sandra Kahn, orthodontist from San Francisco in the United States, developer of the Kahn Bow, very innovative reverse face mask for class 3 malocclusions, and my co-author in the GoPEX book. And we have Mr. Roland Barrowman, a MaxFax surgeon based in Melbourne, who we will be sharing with you some of the more mature children's treatments and the adult treatments that have missed early intervention phase and will be treated through orthognathic surgical procedures. So we look forward to seeing you all at our next 2-day introduction, Postural Orthodontics.